Good afternoon, friends. This is Dr. Bharati Morey from Airoli, Navi Mumbai. Season's greetings from Shakuntala Women's Hospital, Airoli, and a happy Raksha Bandhan. Today, the topic is diabetes mellitus and India. Where are we? You all know that diabetes mellitus is very common in India, and India is known as the capital of diabetes mellitus. Incidence is as high as 11 to 14%. And with this diabetes mellitus, the complications of hypertension is as high as 36%, and thereby cardiac complications associated with it. Friends, as the primary caretakers, I think we are the most dependent people who can and who get the access to the patients, whereby we can, by simple test of fasting blood sugar and a blood sugar postprandial, we can pick up the cases in time. Therefore, the women, they are not going through complications, and the maternal mortality of India can come down. We get patients right from adolescent health to the postmenopausal age. So a simple test can do a lot of things, especially in antenatal condition when patients come to us for the routine antenatal care. It is our duty to do the primary test of 75-gram loading glucose to be given, and 2 hours after that you take the blood sugar. Anything less than 140 milligram percent is normal. Anything more than 200 milligram percent definitely diabetic. In between 140 and 200, the girl has to be investigated also, so that she doesn't go into 200 milligram percent over the time. What are the complications that one faces? Most important is that if she's a diabetic, pre-diabetic, not controlled, and she conceives, there are chances of 8 to 12% of her having an abnormal baby, and chances of for abortions are there. If she goes through till the ninth month, chances of a large baby, therefore chances of operative interventions, high risk of cesarean sections if the sugars are not poorly controlled. Then what happens is she has to go through all these complications and the increased maternal mortality. But believe me, if she's picked up in the first trimester or maybe before conception, if she's picked up, sugars are controlled well with the diabetic diet, with her medicines, there's a medical management, and insulin at times needed, this girl falls as a normal patient, and her obstetric indications for cesarean section will go as other normal non-diabetic patient. So friends, therefore, I feel that we as primary caretakers should take the responsibility of detecting diabetes mellitus in patients as early as possible, and therefore help our nation to come down as far as the diabetic capital level has gone to our India. Thank you, friends.